Epidemics are nightmares that have haunted human civilizations for centuries. From the Black Death, smallpox, and the Spanish flu to Ebola, SARS, and COVID-19, these diseases appeared like an assassin, leaving death and panic in their wake. For a long time, lack of scientific research and weak public health measures limited the ability for communities to cope with an outbreak, causing people to take few effective and sometimes even wrong measures to counter it. For example, the Black Death, or Black Plague, which was one of the fiercest pandemics in human history, ran amok in 14th century Europe. The deadly disease wiped out 24 million lives within 5 years and decreased average life expectancy on the continent from 40 years to 20. Doctors had been rightly aware the disease was infectious among people, but wrongly assumed it was caused by noxious bad air. They isolated patients from the public and designed a curved beak-shaped mask stuffed with camphor and roses to stop the spread. But they had no way to know Yersinia pestis was the real culprit and could be hosted by countless fleas and rats from streets and alleys. When little could be done to control the disease, widespread death and disruption followed. The same mistakes were made again during the 1854 Broad Street cholera outbreak in the UK. Authorities wrongly insisted the spread of cholera was through air and not water, leading to 500 deaths within 10 days. But such events are often followed by great change. In 1885, French biologist Louis Pasteur created the first vaccine for rabies. It was a start in humans taking a proactive approach to epidemic prevention. Thereafter, Yersinia pestis was discovered in 1894 and penicillin in 1928. With the development of anatomy, physiology, cytology, bacteriology, and clinical medicine, the death rate of epidemics fell sharply after the 20th century. In 1980, the WHO declared the world free from smallpox, which is the first and the only complete victory so far. That was a big step for mankind. In the recent COVID-19 epidemic, China sequenced and reported the genome of the virus within a month since it was discovered in December 2019. Local and global communities were also all activated to fight the outbreak rapidly. Gaining victories over an epidemic is still hard, but it's getting easier as science catches up, easing the fear of the unknown. It seems we are making progress, right? At the same time, there's a need to remember there's a lot we don't know. According to data from the World Health Organization, there is still no preventive treatment for MERS, which has a 35% mortality rate. There is also no cure for AIDS, which has already killed 32 million people worldwide. Epidemics are inescapable, but humans cannot afford to give up the fight. Reality tells us that in today's integrated world, we can only advance with science and technology, a well-organized health and emergency system, and an open mind to collaborate.